Dr. Grover, what causes veins to bulge and become these huge varicose veins that give us problems?
Veins have a specific job. Their job is to return the blood back to the heart. The arteries have a nice heart to pump the blood through them. The veins don't have a pump. So in the veins in the leg, where we usually see most of these issues, the veins become what we call insufficient or incompetent. They're no longer moving the blood back like they should. And I've got a picture here that shows how that works. It shows a valve in the vein. All of the veins have valves in them. The valves, as you walk, the muscles will contract and it puts pressure on the veins. As that pressure squeezes the vein, the valves keep the blood moving upstream.
So it is the only kind of pump, if you want to call it a pump. That's the only thing that gives it. So really, exercise is good for vein care.
Exercise is very good. Actually, the simplest is the best, walking. And once these valves in the veins go bad, then that vein no longer pushes the blood out like it should, but the blood pools in your leg, and then you start getting the complications of the blood pooling, which leads to varicose veins, skin discoloration, pain, burning, itching.
And this picture here is showing that how it just continues to bulge because the blood's pooling in there.
That's correct. It shows blood pooling in the leg and the varicose veins start bulging out. The picture next to it, it explains how a valve goes bad, and now the blood can flow downstream as well as upstream. And it's a progressive disease. It actually will extend up and down the vein as it becomes an issue.
You know, I've never had it explained to me that way, and that's very simple now to understand. And the fact that you just said the artery with the heart having that pump, our legs, our veins just have that little tiny valve.
The valves in the vein is what really keeps things moving in the right direction, and when that valve goes, or when a valve goes bad, it's not necessarily a specific valve, right. Then we start having issues.
Okay, and then you can take care of those issues with different kinds of procedures. And in fact, you have a video here showing some. Tell me some of the procedures, actually.
The traditional treatment for varicose veins was stripping and ligation. Stripping, we basically take the vein out of the leg. It's kind of brutal. Has to be done in surgery, general anesthetic, and you have to lay around for a couple of weeks afterwards to let everything recover where we've pulled this vein out. The blood then learns to divert into the veins that work, and it gets out of the leg through the veins that work.
So it sounds like a procedure maybe I don't want to go through if I don't have to. There are better ways.
There are definitely better ways. We started doing some research because after we got to where we could do stripping really well in the office for taking care of these problems, the patients are still laid up for 2 weeks. Right. Doesn't matter how good we are in the operating room, the patient is laid up for 2 weeks. So we started looking at some of the other things, and some of the other things include laser and radiofrequency. The first treatment besides stripping was a radiofrequency catheter. It's been out now about 13 years. Then 3 or 4 years later, they came out with the laser, and radiofrequency refined their catheter, and now we have a new catheter for the radiofrequency, which is actually showing better numbers as far as how effective it works.
Now, is that this program here that you have a demonstration of?
This is. Let me start this video. This shows a laser on the bottom and a radiofrequency treatment on the top. We've got a timer counting it. The laser basically vaporizes the blood at the end of the laser tip, generating the heat required to get into the vein wall to cause the vein to close down. They both actually accomplish the same thing, just in different methods. Radiofrequency heats up the vein wall by direct contact. So the radiofrequency has to be touching the vein wall. And the radiofrequency catheter that we're using now does a 6.5 centimeter segment and 20 seconds. So we're not moving the catheter while we treat. Laser, you're still moving the catheter while we treat, and the laser jet is much hotter because it doesn't directly touch the vein wall. The laser will burn much hotter. Most patients will notice a little bit more tenderness and bruising, but it's not a real significant amount. But I like the controlled radiofrequency where I know I'm touching the vein wall and I'm not generating a significant amount of heat in the leg to do the treatment.
And then with the downtime, what am I looking at with a procedure like that?
The laser and the radio frequency ablation are both about the same. Take it easy for the rest of the day. Tomorrow you can do your regular activities, nothing strenuous for a few days.
Isn't that amazing? That sounds so much more pleasant than this 2-week deal and the stripping. So to come in and have your legs looked at, I guess all they have to do is call you.
Yeah, they call in, let us know that you're having some vein issues. We answer some questions about what kind of medical history there is, and then we have to do an ultrasound to document the disease in the leg so that we treat the correct veins, and then it's just a matter of making sure we get your insurance company to approve it so that you don't get stuck with a big bill, and then we're ready to go.
Well, it sounds like an easy fix then, easier fix than what it used to be to have pain-free legs right here with Dr. Scott Grover. Give him a call, and your number is?
752-7123, and we're in the Logan Medical Complex next to Spence's Pharmacy.
752-7123. What an easy number to remember. There you go. Thanks so much.